I'm with Gre Luyten, who joined Optical Express Netherlands in 2014 as Chief Medical Director and immediately became a member of the International Medical Advisory Board. Gre, you're also Professor of Ophthalmology at Leiden University in Holland and Head of Department of Ophthalmology there, and also at the Bernova Hospital at The Hague. That gives you quite a unique profile to add to IMAB.
Yes, thank you for inviting me. I've been always working at the academic hospital for already many years, and my specializations is cataract and also lens replacement surgeries. I'm really flattered that I'm invited by Optical Express to join and to help Optical Express in Holland and to improve quality of the surgery in Holland. And I'm also flattered, of course, that Steve invited me to become a member of IMAB, and hopefully I can contribute to the quality and safety and efficacy guidelines for Optical Express.
Now, you began your career in cell biology and genetics. At what point did you decide to change to ophthalmology?
Well, in fact, I was already interested in ophthalmology during my secondary school. But I found out during my medical school that I was also interested in genetics, and so I worked at the Department of Cell Biology. But then again I met people in ophthalmology, so I started my career in ophthalmology as a resident. Later on I got interested in the phakic IOLs, phakic lens replacement surgery, and in fact I was one of the first in Holland who started with this kind of lens. And these lenses especially for patients with high myopia, hyperopia and astigmatism. And when I was busy with that, they asked me to become president of the Refractive Surgery Society in Holland. And as this function I started to prepare the guidelines for refractive surgery in Holland. And not only the guidelines, but we also started up the visitation and accreditation officially for the ophthalmology group in Holland.
Gre, you've had over 100 papers published on IOL and related ophthalmology issues, but you've also been responsible for increasing the ophthalmic pool by nurturing an increasing stream of PhD students.
As a chairman of the Department of Ophthalmology, I'm responsible of the whole department, so I have to do the finance and personnel, etc. But not only that, which is of course a lot of work. I am responsible for the residence program, and I've now about 18 residents working for me, and I have to prepare them for the future to become good ophthalmologists, and they are prepared to do all the cataract surgery in the future. So next to that I'm also responsible for our research, and I'm always interested, I've been always interested in oncology and lens replacement surgery. And therefore I had, starting already more than 15 years ago, after my PhD, I started to raise other young students to become a PhD student, and that's really interesting to work on. And of course, patient care is a very important subject I'm working on. In the last 20 years I worked in oncology and on lens replacement surgeries. And especially I have been working on uveal melanoma, which is a malignant tumor in the eye, which we can treat with surgical procedures or with radiotherapy. As in the last 8 years I've been working in Leiden University, and we became the national reference center for all the diagnosis of malignant and non-malignant tumors in the eye, and also the treatments of those patients.
So Gre, you have an interesting situation in that you have a wife who's probably more famous than you.
Yes, I think you're correct on that. My wife is working really hard, and maybe harder than I do. She's now training the top management of one of the largest banks in Europe. And she was, at one time, she was the businesswoman of the year in Holland. So yes, you're correct that she's quite famous. So about 27 years ago, when we met, we are starting to live together in Rotterdam when I started my residency. And so our houses became bigger and bigger, and at one time when I was appointed in Leiden, we moved to Leiden. In fact, we moved to Oegstgeest, which is a very small city just close to Leiden, and we love to live there. And our children, Marek who's 15 years old, and my daughter Helder, who's 10 years old. We like to live there. It's very nice surrounding and the people.
So although your wife's quite famous, I understand she's quite lazy in the kitchen.
That's correct. Well, in fact, she never cooked since we met. So, but that's luckily for her. I love to cook, and that's probably one of my biggest hobby. Probably it's more than a hobby alone. So I like to get the stuff for the cooking and prepare the meals. And it's also for me it's very relaxing to do this. And well, when I have in my spare time, when I don't cook, I do sports, and I love play ground hockey for many years. But since a few years ago, when I had problems with my knees, I had to start with bicycling. And of course, I do that with more enthusiasm than I probably should do. This year I went with my bicycle from France to Holland, so about 200 kilometers a day for 7 days, so 1400 kilometers. So I lose some weight, but also my children and my wife lose some weight because I couldn't cook.
So Gre, can you just think a little bit into the future and tell me what you think might be the future for laser vision correction and intraocular, and what contribution can you make to that?
What you see in the market right now is that we are doing much more lens surgery than we did in the past, and that's especially my subject where I'm specialized in. So yeah, Optical Express is doing 10,000 of patients each year, and so I think the issues of safety and efficacy are very important. So with my experience in making those guidelines in Holland, that would be very helpful, I think, for Optical Express, and I'd like to help them with this.
Gre Luyten, thank you very much.
Thank you very much.